Hello, I'm Jen, and pleased to be able to share with you the importance of cultural competency and access to quality of care. The impacts of COVID-19 pandemic have brought health and healthcare disparities front and center. However, disparities in healthcare are not new. Health inequities have been documented for decades and reflect long-standing structural and systemic inequalities rooted in racism and discrimination. When we talk about healthcare inequities, we are focused on the differences in treatment between one group and another group. In this context, we're going to focus on the inequities in the doctor's office, what actions need to be taken, why we need to take action, and how we can implement change for the better. Quality healthcare access isn't the same for everyone. Health inequities are a challenge to the healthcare community, but healthcare providers have a powerful tool at their disposal: cultural competence. Cultural competence in healthcare is the knowledge and practice of treating the people of racially and culturally diverse backgrounds with respect, dignity, and without bias. Let's talk about linguistic competence and cultural competence and why that's important for a primary care provider. Linguistic competence is making sure we have culturally appropriate material in different languages, bilingual staff, and qualified translators. Cultural competence is about behaviors, attitudes, and policies that come together to enable effective interactions between patient and doctor. The goal is to value diversity, assess yourself and the patient to identify personal biases, manage the dynamics of differences between the patient and your own beliefs, acquire and institutionalize cultural knowledge, and adapt to diversity in other cultural contexts, individuals, and communities served. So why do we need to take action? Why do healthcare providers need cultural competence? Patients share that positive interactions with their doctor impact their understanding of their healthcare needs, opens a dialogue, and leads to better health outcomes. In contrast, research demonstrates that a lack of cultural competency and a negative interaction between patient and doctor can cause a delay in treatment and poor health outcomes. Research also suggests cultural competence may improve physician-patient communication, increase patient satisfaction, improve clinical outcomes, and reduce health disparity. Healthcare providers are well positioned to have a significant impact on health disparities in public health. They have the power of communication and the ability to build trusting relationships. Dr. Wilson has joined us to help us understand what we can do to implement change, introduce cultural competence to the healthcare community, and evaluate its effectiveness. Dr. Wilson, can you elaborate on the importance of cultural competency?
Sure, Jen. For example, race, socioeconomic status, health literacy, and other factors can influence various things. How patients perceive symptoms and health conditions, when and how they seek care, what their expectations of that care is, what their preferences are regarding procedures or treatments, and their willingness to follow doctor recommendations and treatment plans. Also, who patients believe should participate in making those healthcare decisions. And while cultural competence in healthcare initially referred to meeting the needs of people from distinctive ethnic and racial groups, it now also refers to meeting the needs of people with disabilities and those from diverse socioeconomic backgrounds and members of the LGBTQ community. With training, physicians can learn how culture and ethnicity, both of their patients and of themselves, can affect the care they deliver and the health outcomes of their patients.
What would that training look like?
Well, there are several types of training, and the most effective are those that teach active listening and how to use non-stigmatizing language, while understanding the differences and identifying your own values and beliefs while being able to put those aside to help your patient. We have a lot to do to train our med students and our practicing physicians. There's a lot of evidence to support cultural competence and the value it has on treating the patient and the improved healthcare outcomes.
Thank you, Dr. Wilson. Let's take a look at some of the initiatives that have been implemented to address cultural competence and quality of care.